What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dassani, and we've had some amazing guests, haven't we? Well, I have a guest that I think I can take the liberty of calling my friend. We've been chatting away. We have so many common points that we've been able to dig up, going to dental school 10 years apart, maybe longer. Back home in India, our affiliation with Boston University, and of course, our love for all things Airway. So I am super excited to jump into this conversation. Our guest today is I'm going to try and not butcher her name, Dr. Tina Rokadia. She is a prosthodontist by training. She's based in Dubai. There's the cool factor. But she also does a ton of sleep. Am I wrong in saying that your practice is inclining more towards sleep and airway dentistry now? By the way, welcome to the show. I'm so stoked to have you.
Thank you. I've been watching your journey for a long time, Dr. Dassani, and I'm completely in awe of what you have built and the amount of work that you do towards raising awareness in this space. To answer your question, yes, it's been a bit surprising, but my practice has moved a lot away from pros and implants and veneers into the space of airway, mostly for children and then for adults as well.
That's amazing. So how did this come about? There's always, I know, a personal something there. At least it was for me. So what prompted the shift from prosthodontics, which is restorative dentistry, for those that are non-dentists that are listening in, towards airway? What prompted that shift?
It's all right. There always is a personal story connection with this. For me, it wasn't one person. There were a few things going on simultaneously. I had a brother-in-law with premolar extractions who was snoring at the age of 23, and that was continuously getting worse. And, I never really had anywhere to send him to in the city. Then I had a child who didn't have any of the symptoms that I thought were related to like sleep, but he was snoring and he had an anterior crossbite. As I unearthed that, I realized, he has a tongue tie and he actually has his real picky eating coming from there. Me, on the other end, I had just allergies and was perpetually mouth breathing from a really young age with no one pointing out that this was a problem. So, in my late 30s, I was perpetually tired, but, I was checking iron levels and vitamin D levels, and no one had really pointed out that how about treat the allergies and, work on my mouth breathing. So that's what this combination.
And that's where we get it, right? As busy moms that are trying to do so much. I know I was told, you're doing too much. You need to ease up what you're doing, do fewer things. And breathing just somehow never seems to be, maybe you're not getting enough oxygen.
Right. And, there isn't much explanation around that in allopathy mostly ENTs end up correcting septums, reducing turbinates, and giving sprays. But there's no talk about nasal resistance at all. But yeah, that's a really large upcoming challenge for all of us to treat.
And, I'm so glad you are on the forefront of this, helping your patients and everybody around the world. I love that technology has us so connected, where you're sitting in a different continent, a whole different time zone, and we're able to have this conversation. So let's dive into this. You mentioned you noticed that your son, right, that needed the release, and it was contributing to his picky eating and all of that. We've had quite a few guests that we've spoken with about tongue ties and such. Again, I don't think we can spread the word enough, but I know you are trained with the Breathe Institute, as am I, with Dr. Zaghi. And let's dive into, if that's okay with you, into functional releases, into what a functional frenuloplasty really is. And let's go down that rabbit hole for our listeners. So why don't you tell us, what is a functional frenuloplasty and how is it different from just a snip?
Right. So this is a concept that was created by the Breathe Institute and Dr. Zaghi. It was created because, tongue ties did have a bit of a bad rep saying that they don't actually help. So he put together a protocol that allows us to show that there is research and that there is a way of planning that brings everything together. So the first aspect is appropriate patient selection, right? We can't go around releasing tongue ties in everybody. We have to check if they're actually affecting the function or not. Second really important thing is to check that nasal breathing is okay. Irrespective of what you do with the tongue, if you cannot breathe through your nose, your problems with sleep apnea are not going to go away. So that is, essential, or sleep apnea or any form of disordered breathing are not going to go away. The third really big thing that they brought in was this combination with myofunctional therapy. So, I went into other research as well. What we're trying, the reason we're releasing tongue ties is so that we can have the goals of myofunctional therapy achieved. So the combination with myofunctional therapy is so essential. I also liked the idea that irrespective of the tools that we're using to create that diamond, we're still going ahead and suturing that. Is really, do we leave any other wound open in the body? We do tend to suture all of them. So this primary intention closure, which reduces scar tissue, is another tenet of treatment for them. And then you continue that myofunctional therapy. So I think this is what covers the functional frenuloplasty or a functional release procedure.
What does this look like in your practice? Say I am a patient at your practice, or I find you. What is this workflow, not just at your end, but what what does it look like for the patients?
Yeah, so we go through a fair amount of diagnosis. Children are easier to treat than adults because the problem is often less complicated. But with adults, I will do a CBCT as well as a sleep study to know what is the airway space presently and what is their level of sleep disordered breathing presently. With children, we ask for videos of their sleep. Once this diagnosis is done and we agree that there is enough space for this tongue to be released, and I can get into that on a separate topic, we start with myofunctional therapy. Now, sitting far away from the rest of the world on, where this was a completely new concept, it has been challenging to find the right practitioners for myofunctional therapy. But I've done really well with, all the support from everyone. So I have a couple of different people online. And then we have one myofunctional therapist in Dubai too now. So we refer patients to her. Patients go in and do about 6 to 8 weeks of tongue strengthening, understanding these exercises before they come back for the release. Post-release, they are going to continue with myofunctional therapy to help strengthen and stretch that tissue. The difference comes in this idea of tongue space. I will not release children who do not have, or adults who do not have enough tongue space. Over there, the concepts in Dubai are slowly evolving. So sometimes we will do creation of the tongue space, the expansion of that upper jaw before a release in really young children, because, we are hoping that their own tongue will create some of that growth, or by wearing things like Healthy Start or Myobrace or Vivos guides, that they'll get there on their own. But in adults, we refer first for orthodontics. I have a great orthodontist in the office. We do MARPI. We, work around these issues and then release the tongue.
Do you get pushback from adults in my practice, I find that when I talk about all this for children, parents are like, yes, let's do it. They understand it. But when I have these conversations with adults, it's getting a lot better. They're like, well, I've done so good so far for the 35 years or 40 years of my life. Do you find that as well? Or maybe you have some magic verbiage that I can borrow from you?
You know what? No, I don't. And I will tell you that so it's really interesting for me to practice in Dubai because I see people from so many different cultures and so many different ethnicities. So, when in Airway we talk about epigenetics, fine, not genetics, but, the environment surrounding the human. Well, Dubai really brings together people from everywhere. So what I find is that firstly, the adults who grew up in the Middle East, in Asia, they are not as narrow, as collapsed as the Caucasians are. So that's one different challenge that, we see that happening. The second is that generally people are not aware of what poor sleep is doing to them. So I find the pushback comes because of lack of awareness around your own health. It takes a lot to look inward. I remember feeling like that. I used to sleep on average 5 to 6 hours. I was always tired. I was always telling myself it's because, I'm so productive. I get so much done. I go to bed late. I wake up early. But it took a lot to get onto this aura or to start evaluating what a late meal was doing for me or, what snoring could have done for me. So I get pushback from people because I don't think they're aware of the struggles that they are facing. Neck pain, shoulder pain, reflux, all of this seems like we have just accepted to live like this. I have taken
I
on
agree.
I've taken on the aspect that
No,
I'm going to come out here and educate you. And at some point that light bulb might go off for you, but you're right. Adults are definitely more resistant to helping themselves than children are.
I agree. And, I think what I try to drive home the point with adults is you don't know what you're missing, right? It's like if all I've eaten is broccoli all my life, I don't know what a mango tastes like, or you really don't know. You haven't, that's been your normal. Being tired is your normal. You haven't known any better. So I'd really try to drive home that point for adults. But I do think that even as parents, we tend to do that, right? If I had X amount of time or resources, I want to spend it on my kids rather than on myself.
Very true.
And I think that's where a lot of it comes with adults as well. Let's get back into frenuloplasty. So do you do those? Like, what is the youngest age you will do those?
Right. So I only started around age 5. We have some fantastic providers for infants in the city. And then the 1 year to 5 year gap is not as well covered because we don't really have any oral motor feeding therapists that I have found to do some of the work around it. I'm not a pediatric dentist by training, and I don't think myofunctional therapy is effective below the age of 4. I also feel like doing an ineffective release is probably worse than no release. So I delay it up till the age of 5, and then the patients are excited. They're able to sit through the procedure. We don't even need gas at that point. We're just able to get through, and they get through stretches. So that's where I'm at. I occasionally will, have patients ask about that they're doing tonsillectomy, adenoidectomy with the ENT, and the ENT said that they will release the tie, 3-year-old or something of that nature. And I try and explain to parents that know that it might not be a complete release and that this might still be a problem later. But because we don't really have many people specially trained in ties in the region here yet. So till parents are aware that this is, a very severe tie has been, like, let's say, done stage 1 release, then that can continue. And then I release 5 onwards till, as till 60 probably.
Until, yeah. And I know you said you suture post release. Is that correct? Let's get into a little bit more detail with the suturing. Why is it important? Why do you believe in it? Why do we believe in it? And just so we can educate our listeners as to what is the importance.
Right. So let's think of the frenum as a little string underneath the tongue. And the minute there is tension in that string and we release that, so we place a cut in that opens up to be a diamond. Now, traditionally, when this was done in babies, we have to leave the diamond as is. It's a really quick procedure in infants, but they are going to really stretch this tissue out with breastfeeding, with speech, with eating, because they are so little and they heal so much faster. But in anybody like 4 and above, 3 and above, to leave that diamond means that you're going to get a diamond full of scar tissue. A 3-year-old, a 5-year-old is not going to want to stretch that painful tissue out very easy. A parent's not going to be able to go in and do those intraoral stretches with ease. The aim of the procedure was to have a more mobile tongue, to be able to lift your tongue better. So if you have a lot of diamond-shaped scar tissue, how are we actually going to achieve that aim? So the simple aspect with sutures is that we close it into a simple single line. So now you have lesser scar tissue formation, allowing better mobility. You don't have things getting stuck in there. You have faster healing. Like, I don't prescribe antibiotics with this procedure at all, which I know is very standard in other surgical practices. But we don't need it. You have a nice clean wound that's going to heal faster and heal better.
Does this change? Like, does your protocol change when you have a child or even an adult that, like, do you believe in multiple releases, a stage 1, stage 2? What does that look like? Or is everything done at 1?
The very severe ones, the more anterior along with the posterior component ones, do need a two-stage release. And that brings me back to why are we doing the release? We are doing the release because it obstructs goals of myofunctional therapy to be achieved. It doesn't allow that tongue to be raised up. So what I find is that if it is a very severe tongue tie or a grade 4 anterior-posterior combination, they are not able to do any myofunctional therapy before I do a release. So then we go in and release the best we can in the safest manner that we can and go back for a stage 2. Not so often.
Is there a time? Yeah, exactly. It just depends on how severe it is. Is there a time frame that you are waiting between a stage 1 and a stage 2 release?
Usually around 6 months.
Perfect. Yeah, that's what I'm doing too. Perfect. That sounds great. Myofunctional therapy, we talked about, you just mentioned about, going back into the goals of myofunctional therapy, and let's dig into for our listeners, like what it is, why we do it, and more importantly, why do we want to do it pre-release and also post-release? Let's dig down to the basics.
I had a patient and a very popular radio host over here who, described it perfectly as tongue gym. Said, myofunctional therapy is tongue gym. I said, okay, I agree with you for the most of it. So basically it is, I tell my patients it's like physiotherapy, but for your lips, cheeks, jaw, and tongue. We are retraining the muscles to do what they were supposed to do in the first place. And we are strengthening them to do a better job out of doing their roles. So if anything has caused low tone of these muscles, which tongue ties is just one of the reasons that these muscles are, in disharmony. There could be many other reasons as well. Then myofunctional therapy is a set of exercises slowly graded through by a trained therapist to help us reach those goals. So those goals are that we want purely nasal breathing, we want lips to be sealed, the tongue to be up, and to have a functional swallow. Functional swallow is just that the tongue can swallow independently without using your lips and cheeks.
Perfect. Why do we want it done before and why do we want session after?
Yeah, such a great question. It brings us back to what is a functional release. Now, the reason why people have not been believing in tongue ties or, wondering what's the point of doing them is because we don't have a recognition of what is the mobility of this tongue supposed to look like. For, generations, all we have looked at is how far can someone stick their tongue out. Got a little bit better. We said, okay, how far can the front of the tongue go up? But it's only when we start equating the posterior mobility of the tongue to breathing do we understand what the function of this needs to be. So when we start looking at that function, then when we do myofunctional therapy, we can say, okay, it's not going up. So then how much do I want to release? I want to release enough for it to have this mobility. So it's such a team between the myofunctional therapist and the dentist. And Dr. Zaghi will often say that, for his first so many releases, his myofunctional therapist would be there chairside with him. I wish I could have that as well. But it's important to have myofunctional therapy before a release because that's what tells us how much to release. Not too little, not too much, just the right amount. And to have it actually, like myofunctional therapy makes it a very clean release. We have, all the other structures move away and we have dealing just with that tight frenulum.
That is correct. I call it priming the tissue. I tell my patients, when the tongue is a group of muscles, and if I want to train that muscles have muscle memory, right? Over the years, well, not in infants, of course, but we're talking about our children, 5, 6, even, and all the way up to adults. That muscle has developed memory to sit below in the floor of the mouth as opposed to up in the roof of the mouth. And now we're priming that tissue. And unfortunately, it's not just going to spring back up and sit in the roof of the mouth like we want it to. We have to send it to the gym to develop into the tone and the how we want it to behave and where we want it to sit. So I think that is such a great explanation. What should patients expect after after we do a frenulectomy?
Right.
Are they expecting pain, swelling? What should healing look like? And is it different for adults and kids?
So it's definitely different for adults and kids. With the kids, I had my son who I released last year. So I, really know, we always say this, right, in dentistry, that we don't go home with our patients. So we don't actually know what it's like. But, I released him and then brought him home in the car with me. So that was a real learning experience around that. Children heal a lot faster. The first 48 hours are a bit rough. They are on painkillers and are eating a bit softer foods, just a bit cranky, or at least my son was. And I've had other children who wanted to go to school the next day. They said they were fine. There was another one who messaged to say, "Can I have pizza tomorrow?" And I'm like, "No, we still have suture, so let's stay on soft foods for 2 days." But usually by day 3, children are back to normal. Adults take up to a week to feel like their, speech is uncomfortable, eating is uncomfortable for up to 5 to 7 days.
Perfect. And I'm assuming you have them restart myo visits the following day. What is your protocol with that?
So the myofunctional therapist will know beforehand what day the release is going to be, and we'll meet them for either a 24-hour or a 48-hour visit. And they usually just start with the basic stretches, which will just be like touch your tongue here, touch your tongue here. Don't stretch it too much, but just, start mobilizing it. And then they have a pre-frenectomy session that they're going to do post frenectomy to post the release as well. That starts at 1 week. I would like to bring that sooner, but this is working well in our hands for now. So we're not afraid of the stitches falling out or anything like that. So 3 days start stretching, 1 week start exercising.
Perfect. What about those cases when you're not sure that they have a tie? What do you look for, but also what should parents be looking for?
So, what are we trying to treat with tongue tie? What we're trying to treat is that tongue position and low tone of the tongue, right? Where the musculature is just weak. So sometimes we don't know children's tongue tone is so low that I don't know if it's just low tone or it's a tongue tie itself. And I will tell parents that let's start with the myofunctional therapy, because tie or not, we have to improve this tone. And we're going to reevaluate in about 6 weeks. My myofunctional therapist also does a reevaluation in 6 weeks to say, now with more improved tone, now do we feel a restriction? Another thing that, I've heard Dr. Gaheri talk about with infants is that when they do like craniosacral osteopathy, work on body tensions and jaw tension, a tie appears. Now, in infants, it appears. In adults, I'm guessing it doesn't appear. But I do advise them to even try one session of craniosacral osteopathy and say, we will reevaluate in 6 weeks if there is a tie or not. And if there isn't, that's great. But the myofunctional therapy continues as normal.
Perfect. This is a beautiful segue. I was waiting to get into this question. But to drive home the point with what you just said, I tell patients this. It's not, and I even tell doctors when we're training, it's not, have laser will cut, or we all have a frenulum under our tongue. It doesn't mean everything needs to be released. So I love that approach. Let's figure out if it is a tone issue or if it is a tie, or maybe it's both. Typically it's both. Let's figure that out. Body work. Let's get into that. Do you recommend body work to all your patients when you're evaluating them? What does that look like for you?
So the one advantage that we have here in Dubai is we have a lot of body work. So, we're close to Europe. We have a lot of Europeans with osteopathic degrees and chiropractors and some really fantastic ones. I used to see them for my body tension otherwise as well. I always tell them, especially the craniosacral osteopaths, that I have no clue what you do, but it works. They've tried explaining it to me in multiple ways. And what I tell patients is they're working on body tension and alignment with, the fluid that surrounds us. And it is non-invasive and it works on a lot of people. So, I think you should try it. I find that I started believing in it more when I saw how quickly and effective it was on infants. Because as our bodies get more complicated, we can't see release of tension. But you take an infant with body tension to an osteopath, and an hour later, their fists are not balled up and their shoulders drop down and, their head moves more freely. And I'm like, this is the same thing happening to adults as well, but we're not as aware, or even with children. So the protocol there is, if there is very low tone or if they are going to get a release, I will always insist on craniosacral osteopathy. Then that's the body workers that I most interact with and know. I'm slowly building that community in Dubai and inviting anybody who's listening to this podcast and is anywhere to please get in touch with me. I would love to have more information around this. It's also the only way to sort of treat posture in young children to, help align their bodies better. So when I see children with a very severe forward head posture, rib flaring, arched back. Chiropractors don't work in that age group always. Parents are also not very comfortable cracking people's back at that young age. So these are the reasons that I'll end up sending them to CST work.
Yeah, that's amazing. I looked for the longest time in Houston, as big of a city as we are, it's been a challenge finding a craniosacral therapist for us. We're slowly getting around to it too. When I actually see children, body work is one of the things that is listed as it's not optional. Like, I make sure they're seeing either a pediatric chiropractor or an osteopath or a craniosacral therapist. I tend to do a ton of alpha in the practice, and that is one of your protocols when you are doing that for children. So I love that you have that. I'm jealous. I love that you have all those people around there that with such a great community. As we tend to wrap up, I really wanted to jump into fascia. What is the connection with tongue ties and fascia in our body, and what should parents know about this?
This was a very surprising revelation for me as well to understand. As part of medicine, we were really not taught much about fascia, but it's sort of almost like an organ system of its own. They call it the tensegrity of the body. So it's let's think of it like this elastic tissue surrounding a lot of our insides. And we have one major fascial system called the deep front facial line, which runs from the tip of our tongues to the tip of our toes. And while there is lesser research, formal research on this, there's a lot of anecdotal evidence and case reports around, improved mobility, improved posture, patients able to touch their toes better or bend their head sideways better, just with release of these tongue ties. Adults will often talk about feeling lighter, feeling released around it, right? And all of those benefits come from this fascial relief, which is also where body work comes into play, because we're now readjusting this fascial system post our release. I actually have a patient who is a functional pattern instructor. It's a different way of training, and he does have enough tongue space and airway space, but he wants to go ahead and get the tongue tie release done to feel this benefit of a fascial release as well. So that's where I feel like
he sounds like somebody that's super aware of his body and how things can improve. That is amazing. That is amazing. For our listeners, I will have Dr. Rokadia's bio and all the links to her website in the show notes. So if you want to reach out and connect with her, please know that resource will be in the show notes. She also has an amazing Instagram account. Would you share your Instagram handle, please?
Sure. It's called Airway Dentist Dubai.
Oh, that's an easy one. She's based in Dubai. She's an Airway dentist. Airway Dentist Dubai on Instagram. As we wrap up today's episode, what are your top 3 tips to anybody that may be listening, not only for their children, but even for themselves as it relates to airway and, tongue ties and all of that? What are your top 3 tips?
My first one is a general one, something that I've, always lived with, that our eyes do not see what our mind does not know. So let's not shut out information we're not seeing it till we're not aware of it. I think my second one would be that don't underestimate the importance of nasal breathing at any age, from birth till the minute you die. Our noses were for breathing, our mouths were for eating and talking. And it's interesting I don't have a third one. I'll end there.
How about don't stop looking for answers, because there's always an answer. Just because it may not be easily available, it doesn't mean you have to live with pain or tiredness, because you and I are living proof of that, right? We dug for answers when everybody said you're just tired because you're doing too much or whatever it may be. So there's always an answer. Just keep asking. And there's, of course, amazing folks like you out there that are doing so much to help their patients. So I truly, truly appreciate you taking the time, despite all of my delays today. For those listening in, I'm dealing with a sick child. I had to run out the door because school called saying she wasn't well. And Dr. Rokadia was kind enough to say, go take care of your kid. I'll be waiting here until you get back. So I truly appreciate that. kindness. As always, a pleasure connecting with you. Go follow her, Airway Dentist Dubai, on Instagram. I will have all of her website, Instagram handle posted in the show notes. And I will see everybody next time. Thank you.